Good morning, everyone. A lot of people have been asking me to make a video on rhinoplasty. There are tons of videos on rhinoplasty. So, what I'm going to speak today is the importance of listening to your surgeon on what kind of nose shape will actually suit your face. Because nowadays, with all filters and all the AI enhancement, the social media influence, the pictures can be really misleading, and you may think that one particular face may suit your nose, may suit your face a lot, but the reality is that we've been doing surgeries for a long time. I am doing in maxillofacial surgery since 2012, so that's a long time. So our experience does count on judging what kind of shape does look good on you. So in my video, follow the video to see how the judgment and the treatment plan and what your surgeon is suggesting really influences your final rhinoplasty results. Hi everyone. So today we're going to discuss with this case of mine how the tip angle is important in rhinoplasty, especially in girls. So you can see here our patient here, she's got a low radix as per my treatment planning, and then with the low radix I need to increase her height of the nose to make it more balanced with her forehead. And then you can see here that her dorsum, that is the bridge of her nose, is actually a bit slightly more higher, but the main issue is that her tip is extremely flat. She got a very long high tip which is very flat, and then she's also got a very short columella, giving her a very bulbous and large nose tip. So ideally I would like to move the tip slightly up, give her an upturn, give her a slight upturn in the bridge to give her a more feminine nose. Now when you look from the front, what she has is she's got very wide nostrils. She's got nostrils which are visible. The key reason to her visible nostril is that because her tip is extremely large, she's got completely collapsed side alas. You can see those depressions where I marked the blue line, so which is basically giving her a bumpy look to the entire nose. So these are the features which are giving her nose a much more imbalanced look as compared to rest of her face. So I need to get that tip down, reduce her nostril show to make it much more pleasing. Now ideally I cannot reduce the nose too much. You can see here when I try to Photoshop her nose, get her nose little down, the problem is that it gives rise to two issues. One, the nose looks collapsed when I go down, so that's my cue that I should not reduce the nose too much, but I have to increase her deficiency, that is the bone with her nose tip. So I would ideally want to raise her nose tip, graft a little bit of cartilage on top of her bridge, get that nice curve in her nose. And to make the nose more petite and small, I would like to do a slight upturning of the nose tip, not the nostrils, not the columella, but a nose tip slight upturning, which will actually give me my desired nose. So this was my first plan with her, which I told her to get it done, but unfortunately she wanted a straight nose. She didn't want an upturned nose. Probably it was due to my explanation that I didn't probably explain her properly about upturning the nose. She thought it was going to make her nose look piggy. So now I'm forced to keep her nostrils straight, the nose tip straight, but as you saw in the picture, it's in order to keep her nose tip sharper and much more better, because she had a very big nose, I'm forced to go her nose slightly longer to make it look more sharper and better. Now when we go back after the surgery, this is 10 days after surgery, so you can see here she got swelling over her bridge, over her nasal tip, supra tip, and even nasal tip. So all these things are supposed to go down as the swelling goes down, and she should have a good looking balanced nose. Now this is her after 5 months, so you can see here the difference from the front. Her nostrils are much less visible. She's got a good balance of nostrils. Her tip, which was very high, has been brought down to a more acceptable and balanced and pleasing position. Also, if you see her on the sides, the bridge is much more straighter. She's got a nice straight bridge, but there is a bit of swelling still on one side of her nose, that is the right hand side of her nose, but that generally goes away in about a year's time. If not, we can do a little bit of Kennicott injections to get rid of the scar or the swelling tissue which is forming inside her nose skin. Also, you can see that corners on the left hand side, that 2 marks that I've given, the collapse of her alars have been corrected in the post-op 5 months. So overall, there's a marked improvement in her nose. She's 5 months down the line, and you can see from the side view also that compared to her nose before the surgery, she had a big nose. So the nose is much more balanced. But the issue with the nose right now is what I had anticipated. My main anticipation was that in order to keep her nostrils straight and not being able to give her the upturning of the nose tip, her nose looks a bit longer. It looks much better compared to her original nose, but in regard to her chin, in regard to her nose, it's still a bit longer, whereas I would have liked to give her a little tip upturning so that it looks much more balanced. And you can see from the side also, she has no alar collapse. She's got a nice straight bridge, but because of the straight nostrils that I was forced to keep, so she's got a little long nose tip. Finally, she was unhappy with this, and finally she agreed to my original treatment planning that she needs a bit of upturning of her nose. So that is what we need to see here. So we need to push her tip a bit further down, and I need to get that upturned nose tip. So she agreed with that treatment because she realized that the nose looks long, and she complained that the nose is looking long. And you can see here, after my tip revisit, you can see here I've actually now upturned her nose tip. So this has allowed me to shorten her nose. So it has allowed me to make her nose smaller and shorter, more petite looking. So upturning of the nose in girls is extremely important because it gives you that smaller length of a nose, which gives you much more balanced look. So it's important that when you consult with your surgeon, that you have to understand and listen to what the surgeon is saying when you talk about upturning the nose, because on Instagram you may think something looks better, but in reality the surgeon's experience is what counts. And you can see here this.